We have Dr. Grayson Ross. Dr. Ross grew up near Virden, Manitoba, and graduated from the Western College of Veterinary Medicine in 2020. Dr. Ross now manages the Innovative Veterinary Services, Brandon location, and specializes in food animals, as well as equine medicine. Welcome, Dr. Ross.
Am I live? Sounds like it. Good afternoon, everybody. My name is Grayson Ross, and I would just like to thank everybody for coming out today. It's nice to see so many people that have come out and braved the cold, along with some familiar faces and lots of new ones too. And I must admit, a few months ago, I was approached by Hannah Minshall at the Department of Agriculture, and she'd asked if I'd be interested in giving a presentation today. And I was fairly hesitant about it because public speaking is not something that's really in my wheelhouse. So just giving you a warning, if I start to act a little woozy or start slurring my words and look like I'm going to go down, if somebody wants to come grab on to me, that'd be much appreciated. But Hannah was successful in twisting my arm to come out today. And I asked her what she'd like me to speak about, and she kind of gave me free reins with it, but said, you know, given the time of year, if you wanted to talk about something related to calving season, given that it's something that producers are either well underway with, just starting to get into, or maybe just starting to think about, it's a topical thing for this time of year. So throughout the presentation here today, we're going to talk about a few different things, and again, with calving and calving season, there's so much we could talk about, and you know, with different subtopics within it, you could spend an hour or two on each talking about them. So kind of going to paint with a broad brush today and talk about a few things that I find interesting, share some studies with you that have kind of stuck with me and I've been applying during my practice, and also discuss some case studies with you too that are actually, you know, real life stories, stuff that have happened right in our backyard here in southwestern Manitoba, cases that I have helped manage with some producers, and all kind of applicable to calving, if not the period right around. So today we're kind of going to talk about cow and heifer management pre-calving, newborn calf health, and with the help of Clover here, some dystocia intervention. I'm sure lots of you guys have seen her before, either in the flesh or maybe online or whatnot, or maybe some of you have even been more intimately acquainted with her too. So we're going to need some volunteers later on, and if I don't get any, I will be picking you out of the crowd. I see some familiar faces, so be ready for that. And just a disclaimer as well too, the following are recommendations from myself and do not necessarily mirror those of other veterinarians. So the pre-calving period, again, where to start? You know, is it a week before calving is going to start? Is it a month before? Does it go back several months before? And to me, it almost begins back in breeding season there. And you know, with calving, you're almost planning a year ahead every year. You're thinking about sire selections, female selections as well. As you get further along too, vaccinations, what's right for your herd, and why is this important to the unborn calves? We're going to do a case report with that as well, and then kind of a nutrition-based case report as well too. So let's start with breeding plans here. And I hope for this to be kind of an interactive presentation for you guys. If you have any questions throughout, just put your hand up. If I don't see you, just yell them out too, because if you're anything like me, by the time I switch to the next slide, I might have forgotten it. So just holler it out and we'll get to it as they come. But again, I'm going to be asking you guys some questions too. So let's get to the first slide here. So in the pre-calving period, when you're selecting a herd sire, let's just put it to the floor with you guys here. What are some things that you guys as cattle producers are looking for when you're selecting a herd sire or herd sires for your herd? Anybody got any thoughts of what's important to you, maybe based on past experiences or what you've been taught? What are some stuff that you guys look for? EPDs, exactly, yep, that's a very important thing. Some breeds, they're more accurate than others just based on numbers. So yeah, what about some other things? Temperament, yep, for sure. It's no fun calving out man killers, so that's something that you want to deal with. And bulls too, you know, they've got to be something that you can deal with. Anybody else? What are some other things you're looking for with bulls? Birth weight, yes, that's a very important thing. And probably one of the most significant things that people are putting emphasis on when they're selecting sires. And there's a lot of things that can play a role in birth weight. The sire especially does. There's others. It's a multifactorial thing though. So those are all really good points. And let's go to the other side of the spectrum here. Now, female selection. What are you guys looking for when you are selecting breeding females for your herd? I heard something over there. Frame, exactly, yeah. So size of the animal, that's a very important thing to consider. They're gonna have to be able to have a calf for you, right? If they're narrow through their hooks or pins, their pelvic structures may be questionable, that's gonna be a recipe for disaster at some point. I heard something over here too. Temperament as well, yeah, it's same as bulls, that's a very important thing. Can anybody else think of anything else before we move on here? Udder suspension, milking quality as well too. It's got to be an udder that a calf can get latched onto, and it's got to be an udder that's going to be able to provide for that calf as well. And I heard somebody else say something else too. Feet, yes, for sure. We've got to be able to walk, yep. And so something that I'm glad you guys brought it up for both bulls and heifers there too, because it kind of ties into what I wanted to talk about. And it's affecting birth weight. So birth weight itself was mentioned with bulls, and also the frame score of the females there. They're both kind of different but related concepts when you're talking about what is going to influence the birth weight of calves. And like I said there too, it's a multifactorial process, and not one factor alone is responsible for determining the birth weight of the resulting calf. So I've listed a few things there that there's others, of course, but a few things that I think are important and are going to be influencing birth weight. So nutrition, first and foremost, maybe goes without saying, but a higher plane of nutrition in your breeding females, that is going to have effects on the birth weight. If you've got cows that are eating slew hay and bulrushes versus a show heifer that's never wanted for anything, you're certainly going to expect a higher birth weight from the latter there. Weather as well too is certainly going to play an effect on birth weight, and it is a consensus now that colder temperatures seem to bring on larger birth weights on average. The jury is still kind of out as to why that happens, but it's theorized for one of two reasons, and maybe kind of together as well. Just say like this last cold snap we've had for the last few days. Animals, they need to redirect where the circulation in their blood flow is going to stay warm. So during a really cold snap, they're going to try to redirect some of that blood flow from their outer extremities into their more core and vital organs. And secondarily through that, the uterus, which is, nourishing and growing a calf, it's going to get a higher degree of blood flow. And that more blood supply to it, more oxygen, more nutrients and everything is theorized to help contribute to larger than average birth weights in colder temperatures. And also talking about nutrients too, when it's colder as well, cows just in general are going to eat more to stay warm. And the effects of higher blood sugar is thought to have a correlated relationship there with increased birth weights in calves, kind of similarly to what they see in people sometimes. Say a pregnant mother is diabetic, and when they give birth, often those babies from a diabetic mother is larger too. So kind of same in a sense like that. The next two as well, they kind of go without saying. The sex of the calf and breed characteristics definitely play a role in contributing to birth weight of calves. Bull calves on average range from anywhere from an average of 5 to 12 pounds heavier than their heifer counterparts at birth. And amongst breeds too, you just expect a large variation in birth weights to arise there. And that can be due to just size in general, or even how the calves are shaped as well. And gestation length as well too. That's something that particularly in the last trimester and even the last month of pregnancy that really influences the birth weight of the calves. British breeds versus continental breeds alone, you're going to see variation that way. So your Angus, Hereford, Shorthorn, you can usually expect them to have a bit smaller of calves than your Simmentals, your Shars, your Limos. But interesting enough there too, like the longer the gestation period happens, the longer that calf is in the oven, you are going to see larger birth weights. And studies have shown that in the last kind of month, calves can grow anywhere from 1 pound to 2 pounds a day. So, a week overdue, if they're on the high end of that, you could get an extra 14 pounds on your birth weight right there. So Just kind of showing here that, there's not one and only thing that contributes to birth weight. There's a lot of things at play. Certain things are playing more of a role than others. And when I get down to the bottom here, there's two other things. And kind of like what we talked before, sire size and dam size, both of those play a role when it comes to determining the birth weight of a calf. So this is a question I'm going to ask to you guys, and we'll just put it up to a vote. And for those that are going to say the sire, raise your hand first, and those that are going to say the dam, raise your hand second. So who do you think, bull versus cow, is going to produce or contribute more to determining the birth weight of the calf? Let's start with the bull. Who thinks the bull is going to play a bigger role? There's a few. Now, how about the cows? So you're right, it is the cows, and that's nice to see that people know that. It's getting definitely to be more knowledgeable or more well known that that's the main contributing factor. And we talk about inheritance patterns with different traits in animals and people. And when they're talking about birth weight, you kind of break it down in terms of percentages. And they've roughly determined that the cow contributes about 60% towards the size of the birth weight of the calf, while the bull contributes the other 40%. So it is more skewed towards the cow's size. And this is a screenshot from a presentation that I was given in vet school, and it's a graphic that I've never kind of really forgot. I just really like it because it kind of helps illustrate what I'm talking about here. And of course, this is talking about horses and showing horses, but the premise is the same. And this is a study that was done quite a while ago, I believe in the 50s or the 60s, but we've got two kind of matchmakers up at the top there. There on the left, there's a Shire stallion and a Shetland mare, and to the right of them, there is a Shire mare and a very ambitious Shetland stud. And Shires, of course, are a large draft breed, and Shetland ponies are ponies. So you're kind of looking at both opposite ends of the spectrum here. And again, horses show this maybe a little bit more extremely than cattle do, but it's just a nice visual to see how this is done. So somehow the poor Shetland mare, they got her bred by the Shire stud, and when she foaled out, she had a foal that was more in line with that in size of a normal Shetland foal, and it continued to grow more similarly to that a Shetland foal would, as opposed to taking more after the Shire sire. And to the right there, there's the Shire mare and the ambitious Shetland stud. And anyways, he got her bred, and she had a foal, and it was more in line with that of a Shetland-sized, or a Shire-sized foal, and continued to grow as such. So again, they're not going to be completely going after one or the other. It'll be somewhere on some sort of common ground, but it is kind of just visualizing there that the mother is playing a larger role than the sire in determining the size of the resulting, in this case, foal or calf. And this is just some numbers pertaining to that graphic that I showed you there. The top is talking about the horses. They're talking about the birth weights. And at the bottom, it's actually they didn't have a visual for the cattle side of it, but they did actually take some measurements on it. So it's comparing two different breeds, Devon's being a larger breed from England, and Dexter's being a much smaller breed from Ireland. And if you look at the top line there, maybe I can point for you as well. Maybe not. Pretty faint, but there's the Devon there. So we've got a Devon sire, Devon dam, then down at the bottom there's a Dexter sire, Dexter dam there. So look at the birth weights of those full-blood calves. And we've got your purebred Devon at the top there, birth weight of 45.6 kilograms, while the Dexter full-blood there is 23.8 kilograms. So a very stark difference there. And just for time's sake, we'll only talk about the one, but my pointer isn't working again here. And the Devon sire here has bred the smaller Dexter cow. And as you can see, the resulting birth weight of that calf is 26.9 kilograms, which again is much closer to that of a full-blood Dexter in comparison to that of a full-blood Devon there. So birth weight is definitely more controlled by the size of the cow versus the bull, is kind of the take-home message from this. And another thing we're going to talk about too in the pre-calving period is vaccinations. And this is something that I get a lot of questions on at all times of the year. You know, what vaccine should I be giving my animals, my cows, my bulls, my calves? What should I be giving them and at what time? And again, this is a topic that we could talk about for hours, but what I'm trying to hone in on here too is just how it's applicable to the pre-calving period. And something that I think that maybe people, I'm not going to say it's an oversight, but maybe don't think of just the downstream positive effects. Like when you're vaccinating a pregnant female, you know, more than anything, you're doing that to help protect the health of the calf. And this is mostly because calves, unlike, say, people, but calves, other ruminants, foals, piglets, they're born without what I would call a primed immune system. And by that I mean is that they are born with virtually no circulating antibodies in their bloodstream. And why that is compared to, say, other species like us, it's due to differences in placental structures. So, say with calves, there's no real mixing of fetal and maternal blood. So, say a cow has been exposed to the BVD virus at some point in her life. She is going to mount an immune response towards that, produce antibodies. Those will circulate around. And if she were a person, she would be able to pass those antibodies on to a certain degree to her baby in the womb. But that doesn't happen for calves. And so again, there's no mixing of fetal maternal blood in between the calf and the cow through the placenta, while that does happen in other species. So yeah, they're born basically a completely blank slate, and how calves go about getting those immunoglobulins and their antibodies from the dam is from drinking colostrum. So priming the cows with vaccinations and appropriate vaccinations for your herd in your area is something that's very important to, not only for the cow, of course, too, but increasing the colostrum quality so it's more potent and more applicable to the different pathogens, whether it be different bacteria or viruses that that calf is going to interact with in the first few months of its life before it's actually able to start producing its own antibodies and mount its own immune response. And with the vaccines as well too, the overall hope is to try to decrease the risk of both fetal and newborn mortality. So talk about questions I get asked. What's best suited for your herd? And it's tough because when you're developing a herd health protocol for one producer, it could be very different from another producer that's right down the road from them in terms of what they're dealing with historically in their herd. But kind of simply putting it, I would kind of break vaccines up into what I would call core vaccines versus risk-based vaccines. So core vaccines, these are vaccines that are going to hopefully provide coverage for diseases that are, you might call them endemic in the area. They're everywhere. It's something that most cattle get exposed to at least at some point in their life. So BVD, bovine viral diarrhea virus, IBR, which is caused by bovine herpes virus, and your scour vaccines, which offer some concoction of rotavirus, coronavirus, and bacteria, or scour-causing bacteria like E. coli. Also your clostridial vaccines as well too, so your blackleg shots, as people more affectionately call them, so your Tasvax, Ultravac, even your Covax and stuff like that. But then there's your risk-based vaccines, and these are ones that I'm never not going to tell somebody to vaccinate their animals. It's some of the cheapest insurance you can provide for them. But at the end of the day, it boils down to dollar and cents, right? So if there's not an issue in your herd that you really need to deal with or address at this point, maybe it's not something you need to be vaccinating for right now. So say leptospirosis, thankfully it's not a problem in our corner of the province, but as you get further east towards Winnipeg, south of there too, and a little bit east, it is a problem there. It does flare up every once in a while, sometimes causing abortions and fertility problems in herds, along with pink eye and foot rot too. Some people seem to have worse problems than that than others. I'm just going to take a quick drink here. But we'll get into a case report. And I was first exposed to these case reports in vet school, and I really liked them as a learning opportunity because if you're talking about whatever sort of subject matter, doing a case report after it, it's a real world application of it. It's something that has actually happened and kind of helps piece things together. So we're going to do one about vaccines here and another one later on. But again, these are true stories. These are cases that I've helped deal with some producers that I do work for. And of course, it's confidential. There's no names included. Some of it's been changed to make it even more confidential too. But the main idea and the end result and what we're going to talk about in terms of what we did to get to the conclusions are still the same. And these are kind of good opportunities too, where I'm going to ask some questions of you guys. I want to get your thoughts. Maybe you guys have been exposed to something similarly as well. And maybe you have another way of going about it that I haven't thought about, or other people here too. So first case report, it happened in southwestern Manitoba. Was last year. I didn't have the date in here, but it was last year. Commercial cow-calf producer, 200 cows, and they're due to start calving March 1st approximately. The calves are weaned mid-October and sold right around that time as well. And in terms of a herd health protocol or processing that they do for the animals in this herd, It's a bit minimalistic for my liking, but the calves, they receive a dose of Tasvax, which is a clostridial vaccine at the time of turnout. And the cows in the fall, they receive poron ivermectin for deworming. That's it. Now, pardon the graphic picture here, but this is what the producer went out one morning, went to feed, and this is what he found. And I'm sure if you got cattle at home, you probably had a cow dump her calf every once in a while. And a lot of the times it's a fluke thing. It's something that hopefully you don't have to think twice about, and it's not going to happen again. But he went out, he found a cow that she was standing beside a calf that she had aborted, and no signs of sickness. She's still there chewing her cud and everything. She doesn't seem too bothered by the situation. So that's January 3rd. Fast forward a bit to January 8th, he goes out that morning as well, and through the night, there's 2 more cows that have dumped their calves. And at this point, he's starting to think there's something maybe going on here. Like, this is, you expect a normal rate of abortions within reason in a herd, and this is kind of erring on where it's starting to be above that. And anyways, he calls the vet and says, hey, Grayson, something's going on. I don't know what exactly is, but in the last week I've had 3 cows abort. They're all around the same length of gestation, it kind of looks like, based on the size of the calf. So anyways, I went out there and we had a look. And if you go back to that picture there, I'll go back. That's about a 7-month-long fetus there. It doesn't have any hair yet, but normal gestation being 9 months, it's still got a couple months to go. And we looked at the placenta as well as the fetus, and you couldn't really see anything overtly wrong with it. Sometimes, you might get a twisted cord that can cause an animal to abort the fetus, but that looked okay. The umbilical cord didn't look real mangled or anything. And talked about what was going on, getting a history as well, what kind of vaccines he's giving his herd, nutrition, stuff like that. And it was decided that we should submit the fetus and the placenta to the lab for appropriate diagnostics to take place. Anyways, so we're waiting on lab results. A couple days later, on January 11th, he has another one abort. January 14th, there's 2 more cows that have dumped their calves. We're still waiting on results. We don't know what it is going on here. But do you guys have any thoughts or any guesses as to what might be happening in this herd? IBR, you're good. That was short. That's all right, though. But anyway, so yeah, the lab results came back, and the fetus and the placenta came positive for bovine herpes virus, which causes IBR, infectious bovine rhinotracheitis, which usually is a pretty self-limiting respiratory infection. A lot of animals, and particularly mature animals, don't even show any real clinical signs. It seems to be something that's mostly affecting young calves, where they're going to get a snotty nose and a bit doggy looking. But in terms of mature animals, usually you don't notice anything unless they're unvaccinated. And in that case, it can cause late-term abortions. And how it does that is the virus, it circulates systemically through the mother, it seats itself in the placenta, causing inflammation or placentitis. It then passes sometimes into the fetus, and it can kill it, resulting in the abortion. So in unvaccinated herds, usually it's on the lower end, but in really extreme cases, it can result in abortion rates of up to 60%. So thankfully with this guy, we figured out what it was. We were able to run the cows through the chute and give them a dose of Cattle Master quick. It's a killed vaccine, so you can give it to pregnant animals, no issues. And thankfully, it curtailed the abortions. And we only had a couple more after that. So it erred more on the better side, if you can call it the better side, but it wasn't anywhere near that 60%, thankfully, which would have been quite catastrophic financially for the producers. So again, it's an easily vaccinated for disease. It's in most vaccines that carry, respiratory diseases. Bovishield, Cattle Master. I see my Boehringer rep is here, and I feel kind of bad that I didn't mention any Boehringer vaccines, but he can talk about that after if you'd like. But anyways, so yeah, good job on picking up on that IBR. I hope that's not something you've had to deal with, but vaccinate your cows, because it can be, it's one of those things that sometimes it can fly under the radar, and it could be on the the lower side of 5%ish. It might cause the odd abortion and you don't think about it, but in some cases it can really spiral out of control. And we did mention earlier too that we were maybe going to talk about something nutrition themed in the pre-calving period, and so hint for this next case report, that's what it's about. And again, this is in southwestern Manitoba. This time it's a purebred producer. He's got some Hereford cows, about 150 of them. and he's due to start calving January 1st. You know how that goes for some purebred people, but January 1st on the registration papers anyway. And anyways, the calves are weaned in August and September and then sold at a later date. And in comparison to the producer in the first case study, these animals are on what I would consider more of a full herd health program. The cows are vaccinated annually with Cattle Master, which is killed vaccine, Ultrabac, which is a vaccine that provides protection against clostridial diseases, and as well as Scour Guard. The calves are vaccinated with Bovishield 1 shot and Tasvax at the time of turnout, and all animals are dewormed with Safeguard in the fall for control of internal parasites. And again, this happened in 2022, so just a couple years ago now. And cows, they're being fed they're very nice quality hay, nothing fancy by any means, predominantly grass, a little bit of legumes and alfalfa through it. They're also offered free choice loose mineral with salt too. And this producer, he calls me January 9th of 2022. And he says, Grayson, I'm tired. And I said, what's going on? He said, well, calving's just crazy right now. We've had 15 so far. And I said, oh, you're well underway. That's good to hear. Lots of, first service conception. That's good. And he says, well, yeah, you'd think, but of the 15, 11 of which I've had to help deliver. I said, well, that kind of sucks. Like just big calves, like physically it's tough to get them out. And he says, no, they're normal sized calves. If not anything, they're maybe a little bit small. And sorry, just got to get some more water here. But asking him what's going on with these calves. And anyways, he's saying, yeah, they're normal size, if not a bit on the small size too. And they're also weak. They're kind of lethargic. They're not wanting to get up and nurse and do what they should be doing, hot off the press there. But these cows, they start to go into labor. He sees a water bag appear, and either they just lay there and don't want to do anything about it, or they get up and they seem to forget about it and go to the hay feeder and continue on with their day. So he's really got to be watching, because if you're not there for that first sign of seeing the fetal membrane start to come out there, it's something that certainly could result in a high mortality rate in these newborns. So he says, we got to do something about this, because I don't know what's going on. They're just lazy. They're not wanting to do anything, the cows and then the calves. So weak calves, he said one stillborn too, and he kind of attributed that to what I was talking about. Maybe he didn't notice her right when she was starting to calve, and she wasn't getting the help she needed when she needed it. But he was also seeing, an increased rate of retained placentas in these cows. They weren't cleaning after he was having to help them calve. And so anyways, we go out there, collected this full history that I've shared with you already, and it was decided we should take some blood samples, because the gears are already starting to turn into my head. He's telling me that it's kind of all across the board. There's heifers that are affected, there's young cows that are affected, older cows that are affected too, so it's all over the map. And so we pull some blood, we send it to the lab. We're waiting on results here, so put your nutrition caps on. What are some thoughts you guys might have on this situation as to what might be going on in this herd? I hear a mineral deficiency, yeah. Anything else? Do you guys have any other thoughts about what might be going on? Yeah, mineral and vitamin deficiency, for sure, yeah. That's actually exactly what was going on. It was both of those. So lab results came in, and it was found that these animals were deficient in both vitamin E and selenium. And vitamin E and selenium, they're different, but molecularly they're different, but they're very much the same in terms of their mode of action in the body. They're both essential trace elements for ruminants, and they work in the body by having antioxidant functions. And antioxidants, how they usually work is they help repair outer cell membranes if they're damaged, either say through trauma or just normal metabolism. So muscle cells in particularly are ones that it's really crucial to have adequate antioxidants around for, because just through normal wear and tear through the day, they're constantly needing repair and regeneration. And so yeah, these animals were found to be deficient in vitamin E and selenium, and it presents differently, but still kind of similarly. You can tie it together between young ruminants and mature ones. In young ruminants, you mostly see what we call white muscle disease. So up on the screen there on the right, there is normal muscle, and that's, if you were to thaw out a steak or some sort of slab of meat in there in the freezer, that's what you would expect to see, nice pink and red. But then on the left, it's an extreme, but that is white muscle disease, and it looks honestly more like a chicken breast than it does beef. And that's the result of a vitamin E and selenium deficiency in these animals. While with mature animals, You don't usually see the white muscle disease, but, and sorry, I should backtrack as well, but that white muscle disease, that's what's causing these calves to be weak, not wanting to have, or not, I shouldn't say not wanting to have, but not being able to get up and do what they need to do. They just do not have the strength to simply do it. But in terms of mature animals, what you're gonna see with them is suboptimal fertility. This is maybe something that is gonna fly under the radar without knowing maybe exactly what's going on, but your conception rates might be down. 1 year in particular compared to the other. Difficulty calving, again, vitamin E and selenium is needed for muscles to be able to do their job. So the muscles that line the uterus, if they're not, provided with what they need to do to have those forceful contractions to push a calf out, they're not going to be able to do that, and that's exactly what this producer was encountering. What you might see as well too, as this producer was increased rates of retained placentas, and in dairy cattle more so, you might see decreased milk production too. And so we figured out what it was. I was excited to tell the producer, like, we got an answer, we know what it is, like, we can fix this kind of deal. And he says, but my cows, they're already offered mineral with vitamin and selenium already. Like, what can we do differently? So thankfully, there are options for this. And this is a couple of years ago now. And this product in particular has been out for quite a while. And this is what we did for these animals. We mass medicated all the cows and heifers in the herd. Everybody went through the chute. All newborn calves got a dose of this at birth as well too. And it's called Ceylon E. And I'm not meaning to give a plug for them kind of deal, but it worked great in this case. But everybody got injected with this vitamin E and selenium supplement, and the treatment was very successful. Even just after a few days, he really noticed a nice upward trend there. He wasn't having to help deliver these calves. The calves that were being born on their own were also much more vigorous, and they were up doing what they needed to do. So happy producer, and we got it sorted out too. So again, this is a couple of years ago now, and there are some new options that are available to help treat vitamin E and selenium deficiencies. And I'm really happy that these are available here in Canada now, because vitamin E and selenium, basically I saw a map once and it was talking about how there's areas of vitamin and mineral deficiencies in the soil around here. And the map basically extended from Portage to almost Alberta. And there was more pockets than you could count that were deficient in vitamin E and selenium in the soil there. So the animals are grazing that. If their hay is getting sourced from that, you can expect them to have the downstream negative effects of that. So there are products available that can help combat that with, one being Multimin 90. Used to be available in Canada, wasn't for a while, and it is back now. And it's an injectable selenium, copper, manganese, and zinc supplement. It's more meant for animals that are greater than 3 months of age. And then as well is VitaFirst Care. It's an oral vitamin E, A, D, and B12 supplement for newborns. It's a really nice product, gives them a nice perk, especially maybe if those animals are marginal and you didn't know they were. It's meant to be given after colostrum is ingested. So that was great. I hope you guys enjoyed those case studies. You were really quick on the ball to figure out what was going on there. We have a question here. The question was how long does Ceylon E work for? And it's funny you mentioned that, because I actually wondered that a couple days ago when I was starting to make this presentation. And it's not as long acting as we would expect it to be. Like it's a good thing to always give animals. Some products, thankfully in Canada, we have some really strict regulations on what can go into our animals here through CFIA and Health Canada and whatnot. So they have to be really rigorously tested. But some products in the States, and I forget what it was with Ceylon, but some injectable vitamin E and selenium products, most are better than this, but sometimes it's only as good as a couple weeks. So usually it's going to last you for hopefully a few months, but if you get some sketchy stuff, it's not going to be too long of acting. It might help you out in a pinch, like say this guy that was having issues with calving, it's going to give them that boost that they need to get them over and done with. But it's tough to say. It varies product to product. I would probably expect Ceylon, I forget when you said you were giving it, but I would probably expect it to work for at least a couple months kind of deal. So it also depends on how deficient they are in it too, right? If the animal's very deficient on it, they're going to bind that up right away, and they're probably going to need more, or it's tough to know though, right? But yeah, so good question. Thank you for that. Anybody else have anything else before we move on, or no? No, perfect. Okay, so we're going to get into the main attraction here today, and this is dystocia intervention. And we have Clover here. I'm sure, like I said, some of you guys have probably interacted with her before, and we're going to need a couple volunteers. And if this was say I was giving a presentation like this to a 4-H club with a bunch of kids here, I might, it'd be much different what we're going to do with Clover here. You know, everybody puts a glove on and has a feel, and oh yeah, there's a calf in there. But that's not the case today. She's got something much more serious going on inside of her, and we're going to teach you how to manage and hopefully correct a very difficult dystocia. So dystocia, it's a Greek word originally. It's Greek for difficult birth, and it's a pretty economically significant problem, especially in Western Canada. It's estimated annually to attribute to a $90 million loss in the beef industry. Either directly, say you got to come pay the vet to do a C-section, or even downstream effects from that too. What I'm going to mention here too, the negative effects on fertility are a very economically significant thing too. It's been shown on average, cows that have experienced a dystocia or a difficult birth, that they're going to have a 15-day increase in the postpartum interval. And what I mean by that is it's going to be another 15 days between the time they've had that calf between when they're going to return to cycling and be ready to be bred again. And there's also a 15% decrease in first service pregnancy rates too in animals that have had a difficult birth as well too. So it's not a one and done thing. You get the calf out and it's not a problem. There are negative side effects that result from it as well too. And it's also the biggest cause of calf death, even more so than environmental and diseases. And it's another question I'm going to field to you guys, kind of painting with a broad brush. Dystocia, it means a difficult birth. There's kind of three main causes of dystocia. Can you guys rattle off what you think might be the main causes of difficult births in cattle? Size of the calf, probably. Okay. How about a couple more? Body condition, that can certainly play a role for sure. Yep. Maybe affecting the any underlying processes that might be exacerbated with the cow or the heifer for sure. I heard one more up here. Sorry, too. Malpresentation, yep, exactly. And that's kind of touching on all of them right there. So the main three causes of dystocia in cattle, it was mentioned the size of the calf, and we would call that a maternal fetal disproportion. So just a fancy way of saying big calf, small cow. Talked about body condition of the cow. Is there something going on that's maybe hindering her from able to give birth to this calf on its own, or maybe a problem with the calf itself? So a disease or injury of the cow or calf. And then also malpresentations too. And the latter of which is what we're kind of going to focus on here today. This is the question I get asked fairly regularly is, when should I intervene? Because you got a cow or a heifer that's just starting to calve. You don't want to get too antsy, get too rushed with them. You want to let them get a chance to settle in and do their job. But I'm kind of a hypochondriac with my own cows. Some people might say this is too soon to start intervening. But what I tell people is the 30-minute rule. So if 30 minutes has lapsed between the time you've first started to notice the water bag and then the appearance of the calf, if a half hour has gone by and things are stalled out, there's a chance there might be something going wrong. So you might want to think about intervening. Then maybe it gets past that stage and the calf has started to make its appearance. Maybe the toes are just starting to come out, and but 30 minutes has gone by with no progress since that. That's another time where you might want to glove up and intervene. So it's one of those situations where it's definitely better to be proactive than reactive. And I don't want to speak for all other veterinarians, but I think it'd be pretty safe to say if you're calling us for a calving, we'd much sooner want to deliver a live calf versus a dead one. It was just a question up here, I see. And again, it's something that needs to be, that's a good question, because there could be a lot of variation between a mature cow who's a seasoned veteran and knows what she's doing versus a first-time calver. And yeah, they're confused. They don't know what's going on. I'm feeling weird. So those are animals that you probably might be more comfortable leaving for a bit longer to see if they're going to do it on their own. But like I say, if the longer you wait, the longer or the greater the chance there is that there being problems that arise or possibly a dead calf. So watch them closely. Apply this rule as you will to the situation at hand. No animal, no situation is going to be the same. But what I tell people roughly though is every 30 minutes is when you should maybe start reassessing, okay, are things progressing, are they not, do we need to do something different? So yeah, definitely a variation between mature animals and heifers, but yeah, just apply it as you will to your animals at home, but that's a really good question. And like I say, if greater than 30 minutes has gone by, it's probably time to consider gloving up. These are some recommendations of mine too when dealing with intervening with a calving. Always wear palpation sleeves, and this is one to help keep yourself clean, protect yourself, but also protect the cow. You don't want to do any damage to her insides. You know, if you have to fish out a malpresentation, you don't want to possibly cause any tears or abrasions to the inside lining of her uterus, the endometrium there. Always use clean calving chains, no twine. Try not to use twine if you can, but I understand necessity is of the essence sometimes. But clean calving chains if you can with double loops applied. And do you guys know why double loops are preferred as opposed to just a single loop on the legs? Anybody know why that's the case? Exactly, to spread the pressure out. So ideally that first loop, you're gonna have it just above the fetlock or kind of the wrist. And if you can apply a second loop over the pastern there, it's gonna more evenly distribute that weight out there. So if you're having to put a lot of force on the calf to get it out, maybe with a calf jack or something, there's a higher risk of doing damage to that calf in really, severe circumstances. You might even break a limb or cause some nerve damage too, or damage to the tendons and ligaments in there. So lubricant as well, it is going to help you out and the cow will thank you as well. And like I say, almost that 30-minute rule again. If you've been trying to intervene with a calving and it's been 30 minutes, you're not getting anywhere, don't hesitate to call the vet. Because like I say, we're there for that reason. We'd much rather come get a live calf out for you than pull out a dead one. And this is a term that I heard in vet school when we were talking about how to manage calvings, and it stuck with me. And I use it anytime really I'm get called to a calving, reaching in and figure out what's going on. And there was Dr. Datterwall at the vet college that said this, and he says, use your mind's eye. And what I mean by that is have in your head what you should be visualizing when you reach into a cow and what you should be feeling. So just kind of shut your eyes, have a look at this picture. This is a normal presentation. So just kind of get that ingrained in your thought process there. So if you were to reach into a cow, you're obviously not going to be seeing what's going on, but using your mind and using what you're feeling, being able to put a picture together as to what's going on. Have you got two front feet? Have you got a head there? If you don't, what have you got? Can you try to figure out going backwards as to what's going on? So again, using your mind's eye to intervene with calvings is a very useful process. Common malpresentations that we usually see, these are ones that often producers can sort out on their own without issue. You might have both feet back, one leg back, or even a head back sometimes too. Those are, more so the easily correctable ones. But like I say, we're going to try to figure out how to fix a more complex malpresentation today, and we are going to need a couple volunteers for it. And the hint is right here. We're going to talk about breeches. And sometimes I get a call, I got a breech calf, what do we do, what do we do? And sometimes it's not a breech. And there's a difference between a breech and a backwards calf. They're similar, but they're not the same. So I'm going to ask you guys what the difference is, but here's the clue. So all that are breech are not backwards, but not all that are backwards are breech. So do you guys know what the difference between a breech and say just a backwards calf is? Exactly, backwards calf, you're gonna have the feet. If you have a breech calf, I'll show you guys a picture here. So this is demonstrating both. We've got the backwards on the right, breech on the left. Using your mind's eye, if you were to reach into that animal, you don't see any feet coming out. If you were to reach in and all you're gonna feel is the backside of a cow and probably a tail too, that is a true breech versus just a backwards calf. So just a bit of terminology that it was really ingrained into us in vet school. We'd get our hands slapped almost if we called it a backwards calf. No, not really, but anyways, so correcting a breech presentation, that's what we're going to go through here. And again, these are just my recommendations. This is my sort of thought process and order events that I'm going through here. But we're going to need a couple volunteers that want to come down here. And hopefully we can teach you guys how to sort out a breech so you can get this done on your home sometime, at home on your own sometime if you ever have to deal with one. And so does anybody want to volunteer to come down here? If you don't, I see some familiar faces and I'm going to pick you, so. We have one here, how about? Yeah, if you want to come down for sure. We need one more though. There's Alyssa Cooley there. Oh, we got one more here, okay. You're lucky, Alyssa. Okay, so I've got some sleeves here for you guys. It'll kind of be a rat's nest to pull out. They're all kind of stuck together. But if you want to put on a couple sleeves each, And we'll get you guys each to have a reach inside of Clover here, and she is locked and loaded, and you're going to tell us what is going on there. And there is a breech calf, spoiler alert, but you're going to have a feel in there and tell us what you're feeling, and we'll go through on how to kind of correct that. Yep. You can put it over your head if you want to, just to save it from sliding down, but you don't have to if you don't want to. There's just one little...
Oh, perfect.
Yep. Just like that, perfect. I just discovered these gloves last calving season, and I don't know what I did without them for the few years before that I was practicing. They've really cut back on my laundry bill for sure, so they don't slide down or anything. But for the first step here, of course, you're going to have proper restraint of the animal, and you want to confirm the presentation. So we've got a tail for sure. So we've got a breech calf. Well, is it breech or is it backwards? Do you feel legs coming? Okay, so we got a breech calf for sure. Do you want to have a feel in there too? Perfect. And another tip that I learned, I actually saw it on a vet group on Facebook a couple of years ago, and bovine vet truck is what it's called. And we weren't taught this in vet school, and I was kind of skeptical when I first saw it, but I tried it. And it has been a lifesaver for sorting out calvings, especially breeches too. And it's Epichlor, which is, got a breech calf in there, perfect. And it's Epichlor, which is an injectable epinephrine. And I couldn't really believe it when they said, like, this is going to help you during calvings, not only to help revive, calves that are maybe a bit dopey, but Epichlor is one of those things that, or epinephrine, it's one of those things that not a lot of people have on hand, but you probably should, because it's one of those things, when you need it, you really need it. So say you're vaccinating calves, sometimes, once in a blue moon, you're going to get a vaccine reaction and somebody's face starts swelling up. They need a shot of epinephrine right away. But it's also really handy when you're managing dystocias too, because epinephrine, it actually causes relaxation of the uterus. And what that does is if a cow's trying to deliver a breech calf, she's pushing it up. You've got the rump of the calf that's stuck in the pelvis there. There's usually not a whole lot of room to sort out what you're doing, get those legs pulled up to pull it out. What the epinephrine does, and this is something you can get from your veterinarian at home, it's a good thing to have on hand. What the epinephrine does, it causes the uterus to relax. And what that end result is the calf is actually going to fall further away from you. And it sounds kind of counterintuitive, you think you want the calf right there so you don't have to reach in as far, but actually the further it falls into the cow, you're going to get a lot more room to work and be able to manipulate the legs and contort them to what you need to do to be able to get the legs pulled up so you can deliver the calf. So Epichlor, it has saved me a lot of time and a lot of swear words in sorting out breech calves, so it has been a lifesaver for sure. And like I say, if you don't have some, it's a good thing to have on hand, not just for calvings, but also in terms of if just to be prepared in case there's allergic reactions or something. So patience is something as well that you guys are going to need for sorting out a breech calf. It's not an easy fix. It's not a quick fix usually. And like I say too, you're going to want to push the calf back deeper into the uterus if you can to give you them more room to work there. And hopefully whoever the attending vet for Clover here, she gave her a dose of epinephrine there, so that's going to help you out as well. But key when sorting out breeches is once you've got that more room to work, you push that calf away, or maybe the epinephrine has had a time to work and sink that calf lower in. You want to push the calf away from you. And then the hocks. What you're wanting to do is trying to grab the hocks, but also with them, you're going to push them away. So just kind of imagine that. So that, get it in your mind's eye, everybody. You've got the rump of a calf right in front of you, the tail's there, you've figured out where the hocks are kind of down below. You can manipulate those hocks and push them away from you. The secondary effect from that is you push the hawk away, it's going to cause the fetlock lower down in the limb to come closer towards you. So then you can cup that lower limb, cup the hoof, pull it up and pop it into the birth canal. So
then it's coming out backwards.
Exactly. Yeah, I should clarify that too. When you're correcting a breech calf, you're delivering the calf backwards. You're not sorting around so it's coming out the front way. It's coming backwards. Yeah. The main thing is getting the feet brought up so you can deliver it that way. And like I say, always cup the hooves. And why we want to do that is, again, like I mentioned with always wearing gloves, you don't want to do any damage to the cow inside. And the sharp points on the hooves, you don't want to risk causing any tears or abrasions there, because even if you get the calf out, if she's got a uterine tear, the prognosis for her in the next 3 days is not great, and you're probably going to have a dead cow, infection or even death. So, and rest your arms if needed, because there's going to be some pretty forceful contractions going on. So if you need to take a break or tap out, we've got 2 people here. We'll hopefully get one of you guys to do one leg and the other to do the other. So And even for some razzle-dazzle there too, there's Dr. Pole, everybody's favorite vet. If you need to strip the coveralls off to give him a show, go for it. I'm not going to say you need to do that, but go for it if you want. But anyways, so this is kind of just describing what I was teaching there with the breech presentation. In figure 1, that's what you're going to feel. That's what you guys felt when you reached into that cow. You've got the tail, you've got the rump. Could you feel any of the legs there yet, or did you get in that far? Couldn't get in that far, so yeah. And figure 2, showing the arrow there, that's the direction you're going to push that calf, and hopefully that's going to help maneuver the legs up there so you can deal with those hocks. And figure 3 and 4, they're kind of the same figure, just showing it from a different angle. You're pushing that hock forward, which is going to help bring the fetlocks underneath a little bit more so you can grab them while cupping them. And then you're able to, in figure 5, continue to push that fetlock away, or to bring the fetlock towards you, but pushing the hock away. So if you guys want to get in there and try, and maybe in the meantime, if you guys have any questions, you can just pull me over. But if anybody in the crowd here has any questions while they're starting to get after this, that's great. We can talk about them now. Does anybody have anything they'd like to talk about? It's very fast acting. Like I give it right away, and I'm straight into working on the cow. And I would say that I usually see it starting to work within 5 minutes. So it is very fast acting. It's given in the muscle, not intravenously. You could give it intravenously, but it has to be diluted down, I think 1 to 10. And for the time it takes to do that versus the time to actually just get it into the animal, it's going to be working. Just give it in the muscle, and 5 minutes you're going to be cooking with gas. So. In the neck muscle is the ideal location, just like any intramuscular injection if possible, yes. Yeah.
Did you give the shot?
I don't know, fine. I think I forgot. Oh, okay. Anybody else have any questions while they're starting to sort things out here? Upside down calves, sometimes you can just deliver them as long as you can guide the head into the pelvis. You can deliver them even upside down. Something that does work good is a trick I learned. If you can put calving chains on and figure the way that the calf is upside down and which way you want it not be upside down with, get chains on each front leg or maybe back legs, whatever it is, and if you just start crossing the chains and twisting them, whether it be counterclockwise or clockwise, and usually with a hand inside too to help push it, that twisting of the chains and rotating them around there usually helps sort that out. So good question as well. You guys?
What's some advice on some hip locks?
Hip locks. They are terrible to deal with because you get a calf out that far and bang, you're stuck kind of deal. There's really only one thing you can do apart from when you're that far, you can't push it back in and do a C-section. There's going to be too much contamination. But apart from, we got a foot. Excellent job. You want to get the other one? Are they both there? Oh my gosh, you guys are quick. That's great. But anyways, finish the hip lock question here. And then, you want to try to, really the only thing you can do, so the pelvis itself is not a complete circle. It's actually a little bit more oval shaped. They find if you can kind of rotate the calf almost 45 degrees, easier said than done. If you can rotate them 45 degrees one way or the other, whichever way it's kind of coming, that helps give you a little bit more wiggle room to hopefully be able to get that calf out. So.
Have you heard, like, say you get it past the shoulders and then you rotate the calf? Is that a good idea for prevention of hip?
I haven't heard that. It's probably tough to say, like in the heat of the moment, if you're going to know if it's actually going to be a problem. But I'd say probably in 90% of the cases, if you get the head, the front legs, and the shoulder engaged in the pelvis, you're likely not going to have a problem with the back end. But you might see that in some breeds more than others, mostly not in Canada. I had a classmate of mine that worked in Britain for a year after school, and there was a lot of Belgian blue animals there and Piedmontese animals, and they have a lot of myostatin variants in those breeds, and myostatin, it's almost double muscling, but not quite. Those are the animals where hip lock is going to be more common, even if you do get them that far, where the pelvis and the back end of the calf is going to be problematic. Thankfully, we don't really have that to deal with here in Canada. So if you can get the front end through and engaged in the pelvis, you shouldn't have to worry about the back end too much. Yep. So these guys are really fast, and I guess somebody gave Clover some epinephrine, so they were able to get the feet up there. We've got chains here, and if you guys want to get the chain each on one of the back legs there, and if you can manage to, do you guys know how to make a loop with the chains there? Easy to do. I'll show you this.
Go like this and twice.
Yeah, so just, oops, I'll show you.
Turn it on me.
Yeah, just stick it through the one end like that. There's your one loop, so there's above the fetlock. Make a twist, and it's going to be below after that. So if you can't get the second loop on, that's okay. Of course, this isn't a live calf, but then we're going to pull this calf out. They've got a couple minutes to get chains on here, maybe less if they're as fast as they were with sorting out the breech. But does anybody else have any other questions? No? Perfect. 5 minutes, okay. Now, epinephrine doesn't work for this stage, unfortunately, but. And while they're going here, we'll just fast forward a little bit. And so they're not quite at this stage yet, but you've got the calf out. What now? So say you've got a breech calf, either you or the vet has sorted that out. What's something that you need to do after you get that first calf out? What's actually the first thing you should do? Yeah, for sure. Yeah, put the calf in the recovery position. First thing you should do with the cow, as opposed to the calf. What's something you should do? You got the chains on? Perfect. I got some handles for you guys. And if one of you wants to pull, the other one wants to catch the calf, that'd be great. And everybody can see your finished result. You can both go at it, but one of you will need to catch it after. It's pretty slimy. I don't want to do it.
Right? You don't want to pull all the time. Steady when the cow.
Yeah, ideally when the cow is having contractions, you can work with her and get it out there. So say Clover's having a big heave, you guys are going to pull now too. And you've got the hips engaged in the pelvis there, perfect. And one of you guys is going to catch the calf because it's going to fire right out here. I wish you guys could hear the commentary. We got a headlock, not a hip lock here. Just these big-headed Herefords, I guess, but perfect. Good job, guys. Thank you for that. So they've almost got the calf in the recovery position here. He's a little floppier than most calves, but Beth and she mentions that, the recovery position. But there's one more thing. You guys aren't done yet. So when you have a breech,
CPR?
no, well, maybe, but and there's always something you want to check with. And this is a rule we were taught in vet school.
The skin is not on the nose.
Yes, yeah, sorry. Dealing with the cow is what I'm talking about here. So something you want to do with the cow. So anytime you have a breech calf, there's one thing you always got to do, and it's the rule of breeches. Always check for pairs and always check for tears. So you guys have to reach into the cow. It's going to be tough to see if there's a tear, of course, because this isn't a real life specimen, but you're going to be able to find out if there's another calf there. And why we want to do this is because, yeah, she's been through a bit. Yeah. Inside, I meaning uterine tears. Those are superficial. They'll heal up. But 50% of breaches, there's usually a twin in there. And why that is or why the first calf is usually breech, because there's a second occupant in the uterus, and the cow is unable to get that calf twisted around into the proper position to be delivered. So always check for another calf. Thankfully, was there another calf in this cow? No, just the one. So, and you guys couldn't palpate any uterine tears there, because when you were reaching in, cupping the hooves there, you're being really diligent to make sure that they're not dragging on anything. So awesome. Good job. You did an excellent job. So thank you very much for that. And that's it. If anybody has any questions, there's been lots of great ones throughout, but a twisted uterus is no, it doesn't help that way. It won't sort that out. It's twisted uterus, it usually happens more at the body of the uterus as opposed to one of the horns. So that's something that can sort of be corrected by a detorsion rod, or just go straight to a C-section and do that. But unfortunately, it won't sort out a twisted uterus. Yeah. Good question, though. If you know they've happened, you can. The question was, if you have a torn uterus, can you fix them? And yes, you can. It's unfortunately, it's one of those things that people don't know what's happened until it's too late with the animal usually, because sometimes you can reach in as far as you can, but you might not be able to get way up into one of the horns or something, and maybe the calf before you were intervening, it's stressed, it's thrashing around in there. It might have did something that you don't know about. So a lot of the times uterine tears, they're not caught until it's too late for the animal, unfortunately. But if you do know something has happened, during my 4th year, one of my placements, clinical placements, I was at a practice in southern Saskatchewan, and a person brought in a calving. It was in, I think, end of March, and it was a breech, and they had tried to sort things out, and they were able to get the legs up, but anyways, the calf was still too big. It needed to go for a C-section, and we got in there, we did the C-section, and we'd found out when we opened that up that during the process of this producer trying to sort out the calf, get the legs up so they could pull it out the back, there had been a uterine tear. So it was actually really good for the cow that it actually had to go to the C-section, because at the time when she was opened up, we were able to stitch up that hole, and she made a full recovery. Had they got that calf out the back and maybe not known to check for the tears, odds are there probably wouldn't be a cow in a few days. So very good question. Any other questions? Exactly. That's my school of thought on it for sure. It's better to be proactive than reactive, right? You know, if you don't know, I say the 30-minute rule. Maybe you don't know exactly how long she has been calving, and just for peace of mind, we're going to get this done with. We're going to get the calf out. So yeah, nothing wrong with doing that at all. I think we're probably running short on time here. We're done. Perfect. Okay. Thank you.